Hello, my name is Harmony. I'm a PN student at Williston State College, and today I'm going to show you how to do a complete bed bath, oral hygiene, and a complete bed change. I'm outside the patient's room. I've gathered my supplies and checked her chart. I know that she's an unconscious female, so I'm going to put a bath in progress sign up before I enter the room. Then, as I enter, I'm going to knock and wash my hands as I enter. Hello, my name is Harmony. I'm a nursing student. Today I'm going to be giving you a bed bath, some oral care, and I'm going to change your sheets. I'm going to verify that this is Mrs. Jones. Looks like we've got Mrs. Jones and her date of birth is the same as in the chart. I am going to lift the bed to a working height and then organize my supplies. So we are going to put this on the chair. Now I'm going to fill my basins 2/3 of the way full with warm water. One is going to have soap and the other one's going to be plain. Then I'm going to remove her top blanket here. Right, we're just going to remove this top blanket so that we can put a bath blanket over you. And we're just going to set the blanket to the side because it's not soil. I'm just going to make sure it's not on anything that would be clean. And when I left, I would put the side railing up. Okay, now we're going to place the bath blanket on. And then I'm going to tuck this into her gown since she can't hold and remove the sheet. Trying to keep her as covered as possible. And we'll make sure the dirty linen doesn't touch our scrubs. Now I'm going to remove her gown, so I'm going to untie the back, keeping her covered. And then placing this in the dirty basket as well. Now we're going to start by washing her face. So I'm going to place a towel underneath her head so that it doesn't get soaked. I started with the side furthest away from me, so I'm going to wash the side closest to me with non-soapy water. We will wash the eye from the inside to the outside corner. Then we will wash the face, under the chin, up to the ears, down on the neck. If I needed to, I would get it soaked again. Then I would pat dry and remove the towel from behind the head. Now I'm going to expose just the arm. I already did the side furthest away from me, so I'm going to do the side that's closest to me now. I will lift the arm supporting the joint at the elbow to reduce risk of injury. Now I'm going to use the soapy water and I will wash distal to proximal, getting all surfaces of the arm and supporting the joint all the way up into the axilla. I would repeat the same using the non-soapy water and then pat dry. And then recover her arm in the towel. Now I'm going to wash her chest and abdomen. So I will place this horizontally over her and then pull the bath blanket down, keeping her covered. Okay, we're going to start with the chest, so I'm just going to fold halfway down using soapy water. I'm going to wash her chest. We get underneath her breasts. Rinse with non-soapy water, pat dry, and then get the abdomen. We'll use the soapy water again. Keeping her covered. Use non-soapy water to rinse, and then pat dry, and then recover her with the bath blanket. Now we're going to wash her leg. Her legs, I already did the side furthest from me, so I'm going to do the side closest to me. Supporting the joint, I'm going to lift her leg up. You're going to wash distal to proximal here as well. And I want to be sure to get all the way up into the groin, washing all portions of the leg. I will repeat that with a non-soapy rag and then pat dry. Then I'm going to wash her feet, and I noted in her chart that it's okay to dip her feet in basins. So I'm going to start with the soapy bin, supporting her knee at the joint. I'm going to bend it, place it into the bucket. We're going to wash her toes in between and wash distal to proximal. Then we would repeat the same with the non-soapy bin and pat dry. Next, I am going to rotate her onto her side so that we can wash her back and rectum. So I'm going to put her arm across her body when I rotate her. Keeping her covered as I roll her. Okay, and we're going to expose her back, and then lay a towel alongside. Then using soapy water, I will wash her back, getting all portions of it. I would then rinse with non-soapy water and pat dry. Then I'm going to give her a massage, so I'm going to put lotion on my hands, rub them together so that it's warm. I will massage upward and outward. I would repeat this 3 times. Massage the shoulders up into the neck and repeat that 3 times. Then I'm going to wash my hands and put on gloves so I can perform rectum cleaning. I will cover the back and just expose the area that I'm going to be cleaning. I will use soapy water, and before I begin that, I noticed that she has some incontinence, so I'm going to clean it with a tissue by spreading the buttock and cleaning it out front to back. Then I would put soapy water, rag, wiping front to back to clean the rest while spreading the buttock. I would rinse using non-soapy water and then pat dry. Cover her back up, put the towel in the dirty bin, and then roll her back over. I will discard the basin water and rags into the dirty bin and get new water, discard my gloves. And then we are going to be doing perineal care with the new water and basin. Now we are going to do a diamond fold so that we can do perineal care on her. I'm going to start with the side furthest from me to bend her knee, wrap her leg. You want her feet to be flat on the bed, and then wrap the blanket under. And keeping her feet covered. Then we will do the same on the other side. Bending her knee. Okay, so we've got her positioned. I will change my glove, I will put on clean gloves, expose only the area I'm going to be cleaning. Place the clean towel. Then I will use the soapy water first. I will spread the labium, wipe front to back on one side, furthest from me, then the side closest to me, and down the center. Then I would repeat this motion on the external labium. Then I'd rinse with the non-soapy rag and pat dry, and then recover her. Put this in the dirty bin. I discard my gloves and wash my hands. Now we're going to get the blanket back into its normal positioning. Okay, we are going to do some oral care now. I'm going to put the bed in a flat position and rotate her head towards me. I'm going to discard my dirty rags. And now I'm going to pretend this is a sink. I'm lining the sink with towels for dentures. And then I'm going to place a towel behind her head so that we don't get the pillow wet. Put a bib on. And then place the basin here for any drainage that she may have out of her mouth. I'm going to put on new gloves. And first I'm going to be removing her dentures. In the chart it said we will not be putting these back in. So I will grab the dentures from the top, pulling down and out. I will place them in the sink, rinsing them with cool water. We'll do the same for the bottom, pulling up and out. And then again rinsing them in cool water. I'm going to perform oral hygiene before I finish the denture care. So I have checked her gag reflex. She does not have one. So I'm going to be using the sponge to clean her mouth. I already did the side furthest from me, so I'm going to place this in the opposite side to hold her mouth open. The sponge mix is water with mouthwash, and I'm going to squeeze out the excess. I will wash the gums, top and bottom, get the roof of the mouth, and then I will get the tongue good. When I'm all done, I will discard that. And when you're doing that, you change sponges for both sides. Discard this. Then we will pat her mouth dry and apply water-soluble chapstick. Okay, so we're all done with your oral care. I'm going to take care of your dentures. I have my gloves on, and cool water they've already been rinsed off with cool water. So I'm going to apply some toothpaste to the toothbrush, clean the tooth surfaces first, all other surfaces. Again, rinse with cool water and repeat on the bottom teeth, or on the bottom teeth. Rinse, and then you're going to put them back in their cup. Now we are going to do a full bed change. So I will discard my gloves, and then I'm going to start by rotating her onto her side. Okay, we're going to be rolling you around a little bit here, so I'm going to roll you onto your side so that we can get your dirty sheets off. Making sure that her arm crosses her body so that there's no chance of injury. And while maintaining her to be covered. We're going to roll the sheet underneath her. And place the new fitted sheet on. And because she's incontinent, I'm going to be placing a pad under that I will pull on the other side. I'm going to roll her back onto her back. And then go to the other side and then roll her this way. Okay, we're going to do one more roll onto your side, crossing your arm over your body. And I'm going to keep her covered. While she's on this side, I'm going to pull the dirty sheets off, making sure they don't touch my scrubs. And then placing them in the dirty basket. And then pull my fitted sheet over. You want to make sure the fitted sheet doesn't have any wrinkles because that can lead to pressure sores. And then make sure her pad is down. Then we will roll her back this way. Put the side railing back up. Then we are going to put the new sheet on. And now we're going to remove the bath blanket, okay? Making sure to keep it covered with the new sheet. new gown. We're going to start with the arm closest to me. And I'll go around and do the other arm. Now I'm going to pull the sheet back over while keeping her covered. Now we're going to do your blanket. That way you don't get cold. We got a little crooked here. We'll get that all fixed so that you can have a warm chest. You're going to fold this down. Then we will tuck at the foot. And the side railing here. We'll do the mitered corner before we lift the side railing. And this is to prevent falling or tripping. We'll tuck this in as best as we can, without making you feel like you're too tucked in. Then we will do the same on the other side. The mitered corner. Then again, we're going to pull the sides up. Now that we've got you all tucked in, I'm going to do a toe pull. Make sure that you don't get any sores on your toes. And we will lastly change your pillowcase, so I'm going to lift your head up. In the dirty tin, put on the new pillowcase. care that I've done today. Make sure that there's a call light in reach in case she needs it. And as I'm leaving the room, I will wash my hands.